Cross fingers. Great. Testing, 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 testing. Testing. And I need to be careful for, yeah, I'll need to testing, 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 testing. And
We can hear you well. Actually, I may be able to open the breakout rooms here myself. Yeah, I can do it.
let me share. Let me share the slides. Okay.
Should I open the breakout rooms and we test it by going into each one of them? Let's see.
Yeah. 1 second here. I just want to see presentation mode here on the Adobe. I think I'll just do this. Okay.
Do you guys see them open? No?
Yeah, I see from 1 all the way to 40.
Can you join one of them, Ellie? And
Yes.
Yeah. Yes.
and then come back?
Oh, okay. I'm going to number 6.
And this is the Zoom, this is the YouTube link in case I don't think, but in case we need it.
Start working, Enrique.
Excellent, thank you.
If anyone just connected, we'll be starting soon.
Yeah, I'll pause.
We need to remind them to mark leave breakout room and not leave meeting, because when you try to leave, both of them come out and they can see it. So we need to tell them, because that happened a lot before. You remember for the 5 days in 20? We need to do that. Not to click leave meeting.
So I think I can close all rooms and then Ellie's still there? No, Ellie's still there.
Yeah, she's still there.
No, she's not. Oh, she's come back, Ellie.
This is 15. Now she's coming back.
It worked.
Yeah, good, good. So I'm gonna close the rooms and then hopefully when I try to recreate them, they come back as they were before.
And then are we writing down the name of the site?
We can rename. We just gotta wait to see who connects. And we'll just,
Sure.
yeah.
So we have close to 10 sites that have said yes to us. No more than 10
Sure.
so far.
If you guys want, I can, as soon as I keep track of the attendance list, I can start renaming the rooms. So that way we don't like go nuts about that.
So this is what I was trying to do, Andy. Let me see here. Look.
We got people put in Zoom user, so we don't know who that is, but I already see Forza is in, Tamara is in, Arthur is in, Sunilda is in.
Sunil is here. Oh,
Yeah.
okay.
Tamara and Arthur. So either Sao Paulo
Or
and
if,
Santiago.
yeah. Okay, let me just start renaming those.
Okay. So
Solo no
either
alphabet.
Sao Paulo, Santiago DR, and Peru Lima, San Martín de Porres. So, and then, oh, they left. Okay. But we got people putting Zoom user, iPhone,
Mm.
Zoom user, what? Come on. Oh, Gonzalo Romero. Is that the teacher that we used to have for meta-analysis? No.
So Ellie, just so we know, are you renaming the sites?
Yeah, that's what I'm doing right now. I just created
good,
Eidor Sao Paulo. That's room 1. So I will like also mark it in the attendance list so we know. And then I'm gonna rename also Santiago because Sunilda's here.
Do you do country and then city and site, or just one of the name of the site?
I'm putting Eidor Sao Paulo. That's all. Do you want me to put more info? Like I was gonna do.
Maybe Brazil, São Paulo, Idor, no?
Okay.
Because then people, it's up to you. If you think that works, that's fine.
Okay. I'll put Eidor Sao Paulo, Brazil. Right? That's how.
Brazil, better
Or
the
Brazil
country
first. Okay.
Yeah, better the
Country
country
first.
I can also help you. Let me help you out.
The thing is, if you do more than one person does it, then it may mess up. We cannot sort them in alphabetical order.
Yeah.
I looked and
Okay,
zoomed
okay,
in.
okay. I will, okay. What about if I'm marking the sheet, Ellie, and you do
Yeah,
it?
you can mark the sheet. Yes,
Yeah,
please. That
we
can
can
definitely
we
help
can
me.
do faster.
So
Yeah.
it's 4
Thank
o'clock,
you.
please. Should I bring everybody in?
Yeah. Yes. I think you can bring everyone in, Henrique.
Sure.
Okay, hello everyone. Welcome to our open house PPCR 2026. Great to see some familiar faces here. Everyone, hello. So we have some site directors and I'll introduce them as well. I'll introduce them at the end. So more will join us. And we have some alumni, we have some mentors, and then we have some prospective students as well. They are connecting. We also broadcasting this via YouTube. So then I'm sure everyone will be able to see it. Okay. So everyone, again, I wanted to welcome you all. My goal today will be to introduce a little bit about the program for those who are joining, for those who wanted to learn a bit more. And I'll give some examples as well why it is, again, I'm very passionate about this program. I created this program now 18 years ago. 2009 was our first edition of the program, and the goal is to, it's not just to for those who want to become scientists. Of course, that is a very important step, but also for clinicians who wanted to do better clinical work. And I'll explain why. And again, I'll explain why I do think that has a big impact. And that's what I wanted to show here today. Okay. As we are getting more people here joining, but let me start it. We just have 1 hour here, and I want to make sure as well I stop. You have time to ask your questions. At the very end, we're going to do some breakout rooms. If you wanted to connect it as well with your site director, and I'll ask them to say a few words. But then you can have a bit more as well, another opportunity to talk to and ask questions if you wanted to site directors or just in the group here. We have the full staff here. I'll introduce them. So they'll be helping as well with questions in the chat. If you don't want to wait until the end and ask questions while I present, I'll introduce soon Henrique, Neji, Alma, and Ellie. But then I think that's it. And I can start as well as people are joining. Again, welcome everyone. Let me show some slides. And these slides, intentionally, I wanted to use the slides that I use in our first class of PPCR that we call tutorial class. As you understand, I'll go a little bit faster this is a little bit longer class, but at least you have an idea of the program. And I think that's it here. Oh, no, that is the tutorial. No, oops, I just had it one before. Okay, this is the tutorial. Okay, give me 1 second here. We'll find it here. All right, perfect. So everyone, let me start as well, so then we can maximize our time here. Okay, and again, this is a program, as you all know, or you may be getting to know now, but it's a program offered by Harvard T.H. School of Public Health. This is one of the Harvard schools, even though this is truly a collaboration because of the faculty members as well from Harvard Medical School and Harvard T.H. School of Public Health, but the one offering this and their certificate will be from Harvard T.H. School of Public Health if you choose to take the program. But then is a collaboration as well, as we have several members from Harvard Medical School and from the School of Public Health, both of them. I have appointments in both schools as well. The department offering this is the Department of Executive Continuing Education, also in collaboration with the Department of Epidemiology at Harvard T.H. School of Public Health. Okay. And I'll talk a little bit more about, and let me introduce now. I think now, you know what, let me wait for the slides. We'll introduce the team, and then that's it. So, and then I'll start with myself. Again, I'm from Brazil originally, came here in 2003, and I came for a postdoctoral fellowship, and it was interesting. I'll just quickly talk about that. So I did my medical school there, residency, PhD, and then came to Boston. And then in Boston, I came to a laboratory doing my postdoctoral fellowship in Beth Israel, one of the Harvard teaching hospitals. And the first program that I attended was a master's program in the Harvard Medical School, but they had a component it's called Programming Clinical Effectiveness, the summer program, and I did it in 2004. That was a program with statistics, epidemiology, clinical research, and a lot of clinicians attended. And then for me, it made a real difference. Again, I knew medicine, I knew neurology, neuroscience, and so on. But even though I was coming from a PhD program, my basis in clinical research methodology was not enough, was weak, and I knew I needed to do more. And this program really made a huge difference. And after doing that, and I did my fellowship, initially became an instructor, assistant professor, associate professor, then in 2020 full professor here at Harvard. But the training, and I think, oh, this is obvious. It is and it's not, because not all faculty members here at this school and any other school in the US and in the world do have a strong training methodology in clinical research. Some of them, again, you have great scientists in neurology, in cardiology, oncology, that they ended up collaborating with statisticians and epidemiologists and so on. So, but for me, it was not only to design my trials, to do the analysis of my trials, but also it helped me to understand the full picture as well of my clinical thinking, which is also very important for my research as well, of course. So I don't do clinical work now, but even when I was doing, it made a difference as well, understanding more clinical research methodology. And that's what I wanted to show you again. And then PPCR has been running that. So that was a big part of my teaching here at Harvard. And besides, I have my laboratory here at Spalding. My laboratory is in Cambridge, close to Harvard Square. I have about 20 people here, and we have several projects running as well. One of the things, the participants or those who come here in July, they always enjoy coming here. We always have a tour in the laboratory. They like to see a lab here at Harvard running interact with the fellows and so on. So that's a nice experience as well. So, and some of you ended up coming here, as I will discuss, if you are interested in there are other programs after PPCR, okay? And then let me quickly introduce. So we have it, a great component of this program is what we call the program coordinator. And we have Eneji, Alma, and Ellie. All of them, they took PPCR before. Alma has been with us for more years, since 2012 that she took the PPCR. Ellie took PPCR in 2019, and Eneji 2024, three, four, four?
4.
Four, excellent. So then, but again, all of them know the program back to front to back very well, and they give all the assistance to students, to our mentors, and then have a nice collaborative work. Okay, so if you take the program, you'll be talking to them, and so interacting as well as through our coordinator PPCR channel, as we say. And then we have it, the administrative part. Again, we do have this division between education and administrative, but we like as well to have a lot of overlap as well. So the administrative part, that the office of this department, the executive and continuing education, Henrique Coelho, that he's here as well, is our senior program manager. And by the way, if you want just to see them, I went too quickly. And AJ, if you can just say hi, or yeah, and then
Hello,
Alma.
everyone.
And Alma is there. Hello, Alma.
Hi, everyone. Welcome. Just to say that this program is amazing. It's a life-changing program. So if you're hesitating, don't do it. It's really great. Thank you.
Wonderful. Thank you very much, Alma. And then Ellie.
Hi, everyone. We're very, very happy to have you all here. Thank you for joining.
Beautiful. Thank you. And then Henrique, you want to say just a hello?
Hi, everyone. Welcome. We are here to help you. Any questions, just email us. We'll be happy to help.
Beautiful. Thank you very much. Again, Henrique is our senior program manager. And then we have Megan and Natalie as well, working more on the admin side. You'll be coming as well. They may join the beginning of the program. And then Dave is our RT, and then Mauricio, our RT collaborator as well, with many years with us. So this is some part of the stuff. And we have our mentors. I'll discuss what is the mentor is about. This program is very, very different. We have sites all over the world. Here is an example. We have more sites joining this year, so this is not fully updated. And the reason is because things are still happening. So I didn't want to do this slide several times. So then again, we have sites here. We have had sites in Portugal, Spain, Switzerland, Germany, in Europe, Qatar, big site. I just went there, visit the site. We had a program with them in December. Saudi Arabia, I think Abdul is here. I saw him. We are discussing, have a very, very large site in Saudi Arabia. We hope that we can get that all ready for 2026. China, Japan, more as individual students now. And of course, our site in US, Canada, we had before. We hope they join again. Guatemala, large site. Dominican Republic, large site as well. Zunilda, who is the one who truly created and encouraged and promoted PPCR in Dominican Republic. She's here as well. Mexico side is Mexico, Costa Rica, and then Chile. We have 3 big sites in Chile now. Peru, one of the oldest sites, Tamara is here. I saw her connected in the USPM. We have also 2 other universities that may be joining this year as well. But again, our main oldest site is in USPM. Site in Paraguay that's growing. In Argentina, Uruguay, we may have participants joining. In Brazil, of course, we have our largest site. We started with this collaboration with Brazil, and I think we have 20-something sites in Brazil. Some of them, they are joining here today as well. And I think that's it. And again, we may have more sites joining and updating. Again, I'll not go site by site here. Our main site, as you know, we broadcast the lectures here for Harvard Teach, and School of Public Health. We have a special classroom here. That's all technology. That's the classroom has about, I don't know, 20, maybe 20 big screens. The whole classroom, all the walls are with big screens that you can see everything. You can see the sites, the slides, the speakers in different screens, and it's a nice multimedia. The microphones all over the wall. It's easy to talk and to get a collaboration. But an important thing as well, during the lectures, I'm always engaging with the sites, calling the sites, talking to the students. I wanted everyone taking PPCR to feel as part as you are in a classroom here at Harvard. And that's why, so the classroom is all designed to give you a little bit more feeling that you are here. Plus, I wanted to bring you during the lectures on Thursdays. The lectures are live. I know several people ask me, but oh, I can't do it on Thursdays. But again, we do have on Friday something, a smaller version that's not run by me. It's run by the mentors. It's possible as well. So if it's really impossible to come to all the live lectures on Thursdays, talk to me. We can see if it's possible, because an important component is the live attendance. But again, we can discuss by case, as long as I see that you're going to learn it. That's the important thing, to be part of this program. Okay. Oops. What's happening here? Oh yes. So again, I'll just go quickly. I'll not discuss every site in details, but again, we have our sites in Mexico City, Monterrey, the sites Guatemala, in Central America, San Jose, Dominican Republic. We have large sites, as I said, Santiago, in Santo Domingo as well, 2 sites in Santo Domingo. South America have a number of sites. Bogota, we had a large site in Abot. We do collaboration as well, so we have the sites in academic centers, and also we have in collaboration with industry. It's important, and it's a great collaboration as well. Both sides, you learn more about the work from participants or industry, and vice versa. Again, San Martin in Lima, Peru, one of the oldest sites in Lima, Peru. Oops, keeps going. Yep. UPU, a new site. This year, Chile, we have 3 big sites in Clínica Alemanha, Clínica Dávila, and Trabajador. Buenos Aires, we have a nice big site there as well. And Paraguay, a site that's growing, and as I think Laura is here connected, and it's growing as well. They wanted to have a connection with even the other, not just in Asunción, but other cities in Paraguay. And then Brazil, again, that's how we started University of São Paulo. That's actually when I did my medical school, my residency, and my PhD. And then it's still there active, and it's a large site in São Paulo, Brazil, the largest city in Brazil, as you know, and we have other sites in Brazil. Hospital Sírio-Libanês, a large hospital there. AC Camargo Center, IDOR. It's a institute. It's a clinical, but also a research institute that has units all over Brazil, and it's growing very fast. Artur, I think I learned that he's here. Oops, Artur, no worries, I'll update here as a site director. São Camilo also growing with Felipe and Giovanna. I think Giovanna is connecting or connected already. Beneficência Portuguesa, also Felipe is taking over Beneficência Portuguesa, a large cardiology center in Brazil. Oops. Europharma, again, a nice collaboration we have had with them for many, many years, Laura and colleagues, AESP. Ribeirão Preto with Thaisa as well. In Campinas, we actually going to be only in São Leopoldo Mandique, as we have a very large site with about 50, 60 participants this year. And, oops, sorry, what? This sometimes here. Salvador, Brazil, where we do run our 5-day workshop in person. I'll discuss a bit more quickly. We have a nice site there as well in 2 places, Hospital Aliança and the Mater Dei. And then another site in Recife, northeast of Brazil, beautiful area of Recife with Mario. I think Mario is connected. And also we are to finalize, hopefully we have time, with Natal, with Rodrigo as well, that a few participants already signed up for the program. Oops, okay. And then Brasilia's, where's the capital of Brazil, Idor, we have a nice site there with Lucila. Ophthalmology, it's growing as well. I think so far we have 20 participants from Virtu Ophthalmology. João Neves has been doing a wonderful work. Rio de Janeiro, always great students from Rio de Janeiro as well, from IDOR. As I said, IDOR has had sites all over Brazil. And Curitiba, same thing as IDOR, and Porto Alegre as well. And there's this site in Porto Alegre and few other colleagues that are thinking as well of having other sites in the close cities to Porto Alegre. In Europe, Germany, although Chemets will not participate this year, they'll come back in next year. Dresden, they are joining. I talked to Chimo as well. So they also have a master's program. They like participants to do it before, and then they enroll in their master's program after in Dresden. And we can discuss as well continuation of PPCR in master's. Oops, options. Why keep going? Yep. Munich as well. We have a nice site in Munich with Daniele. And then Italy, I think Salvatore is here as well. This nice Institute of Evidence-Based Musculoskeletal Medicine, and Salvatore is growing as well. The site we always have had wonderful participants from Italy as well. Middle East, as I said, here we are changing now, and I think Abidou is here. Tabuk University, I talked to the DRG. They're very excited as well to truly spread it to all Saudi Arabia as well. The site in Tabuk University. Oops. And then Qatar. Sorry, I need to also update this slide. We are changing to the Health Precision, the Qatar Health Precision Institute. I went there to visit. We had a nice collaboration workshop, and then that's what to be. And Raja, our site director, with the colleagues of the Qatar Health Precision Institute. Okay. And then Asia, they're connecting more as an individual connection so far. Oops, no, actually, we do have Asia. I'm sorry. Oops. Yes, Thailand. And I think Professor Aret, she did mention, not sure if she came back or not. She said she had a meeting, but if not, we had a beautiful site in Thailand with participants very engaged as well. And this year, I think we'll have more participants joining as well for rehabilitation medicine. Right, and that's, I think, is our sites. Yeah, my slides keep going on and off. All right, we also have it. You can ask, oh look, I'm not in the places you said. I'm in France or other places in US and so on, and other places in Brazil, which is fine. You can connect it. We call web participants. What is the difference if you connect it through the web? You are not in a classroom. In a way, you can say, oh, it's a bit more comfortable, but that's the disadvantage. So if you're in a site, you have a discount to be in the site. That's also one of the incentives for participants to go to a site. But if you don't, then that's your only option. You can also learn as much as the site students. And then sometimes, even if you don't have a site, we have a small groups. This year also, Professor Messias, who is here as well, will try to do a small group in Lorena, São Paulo. So hopefully we can also do that. But that's the idea. So you can connect to the web to take PPCR. And we also participate in the classes. I call you, you also participated, keep your cameras on and feel you are in the classroom. But of course, if you're in a city with a site, please go to that site to take PPCR. So again, and why research training? And I think you saw the open house. And then one of the things that I put in the open house was why smart clinicians get statistics wrong. And I'll show again, we don't have time, and that's why I'll just discuss quickly these examples. But those examples, and then I'll give some examples as well with the papers discussing, and we discuss as well in the program. But then these required a little bit more time to develop those. But I'll just cite it. And then if you take PPCR, you learn all of that point by point in detail. We just don't have it at this 1 hour open house. But just again, briefly here, why this is important? Because clinical decisions, they rely on what? Statistical significance. Why? Because we use evidence-based medicine, and evidence is based on a research study and a quantitative study. In medicine, very rarely you have qualitative studies. It's not impossible, but that's not an evidence that you use for clinical decisions. So you need quantitative research, and that you need to translate to numbers and have a statistical analysis and then a statistical significance. So everyone knows about p-values. Again, you compare groups, you get the p-value, and according to p-value, you have the decision. And you know, oh, I like the p-value to be what? Less than 0.05. We'll discuss that as a very interesting discussion about 0.05. Can it be 0.1? Short answer, yes, even though not many people would accept that, but it's not wrong. The 0.05 is a convention, which everyone follows, but I think there's an interesting discussion on p-values as well, the value in C. But the p-value is just a number. You need to think everything that was gathered to go to this p-value. And that's an important thing, because if you just go to the discussion, one group is better than the other because p-value is less than 0.05, very likely you get a very incomplete picture. And that's what we wanted you to understand more, okay? Again, a p-value less than 0.05 does not mean the effects are large. In fact, these large cardiology studies with large sample sizes, sometimes a very small effect can have a p-value of 0.04, for instance, and there's no clinical meaning. And very few people understand that. You may be giving a drug to your patient saying, okay, I know compared to placebo, it's better, but the effect is very, very small. So is it worth to give this drug given that all the side effects and so on? So this is something that not many clinicians think when making the decisions. And what is the clinical relevance? What are the outcomes? Because there's a big discussion as well. What does you have studies, for instance, cholesterol levels. Yeah, it's important to decrease it. Yes, so Framingham study. So one of the biggest cohorts in medicine. Framingham is here, a city close to us where we are when I'm here now, and actually was run by researchers here in Boston University and Harvard University. But they show that cholesterol has an effect. You decrease cholesterol, you decrease the number of cardiovascular events. But the story is not as simple as that. So depending on the outcome, even a p-value of 0.05, it doesn't have a clinical significance, relevance. And what is the individual benefits? That is even more important. The studies can't tell you. Very few studies can. It's interesting, our colleagues in Qatar, the Health Precision Institute, that's what they're focused on, and it'll be interesting to have them in the program now collaborating. And again, positive trials can also hide harm. That's a very interesting concept, and more we're studying that. We're studying my lab as well. Sometimes, depending on the type of the patient, the treatment has an opposite effect, you see? And not everyone is aware of that, because when you look the average effects, you don't see the subgroups. And the problem is most trials do not have enough evidence to do the subgroup analysis. So another very important thing that we don't realize that. And again, when you have the means, what do they mean? And it's important to have these large numbers. I'm not even diminishing the importance, but remember, you treat the individual. How to translate that for your individual patient, which is difficult. But at the very least, you need to understand the level of uncertainty. And that's what we discuss over and over in PPCR. And again, the question you should ask is not p-value. P-value is a necessary condition, but not sufficient. You see, you need that. Otherwise, the discussion doesn't even start. But what about the design? Is there any biases that would even invalidate that? How large was the effect? Who benefits? Who is harmed? Is it clinical meaningful? And then you look all types of biases there. Was the randomization doing correctly? Was there attrition? Did they do intention to treat analysis? is there a selection bias in terms of, patients start learning that they were in a group and then they left that. So there's a lot of things can be discussed, and we'll discuss, and we see that at the end of the day, the picture is not, it's not perfect. And that's an interesting thing. I was discussing recently here with some colleagues, and it's so interesting because you start learning PPCR, and then you go and you dissecate a trial, and you look for the trial back to front, front to back, and you start seeing all of that. You say, look, this trial is wrong. And I even see some of my colleagues getting emotional. Oh, this trial is wrong. This is insane, and so on. But be careful. And that's what I also wanted you to understand as you take the program as well. You understand that this is not perfect and it's okay, but how that will translate to your clinical day-to-day work, which is very important, by the way. I'm not saying that oh, then is we live in a era of uncertainty, but at least you need to understand that there are limits of the knowledge and what you don't know, and then understand the uncertainty. Okay, this is so important. When you start understanding PPCR and you start discuss with the colleagues, I see participants changing. Okay. And again, and I'm looking here at the time, and I also give some examples here, many examples. You'll see, for instance, that how we changed the recommendations in terms of coronary heart disease as well, in terms of before the fat was the main culprit of cardiovascular disease. Now we know what is metabolic dysfunction. And one of the things that cause metabolic dysfunction is sugar and diabetes and so on. So, and why we changed that? Because we analyzed data, we analyzed more data, had more studies and so on. And that's science as well. So one thing leads to the other. And I think the beauty of PPCR is start putting together this big puzzle. Important, very interesting thing as well, we discussed in PPCR, we even had some groups that follow up on that, is that even though screening, again, they are important, you can detect cancer in early stage. However, big trials published in New England, Germany, and so on, show what? Mortality doesn't change, overall mortality. It changes mortality related to the cancer, but the overall mortality does not change. You understand? This is a so important study, even though it hasn't changed public policy that much, okay? And that's you understand as well. Sometimes even these big studies, they don't change public policy right away, which is fine. But then how does that affect your day-to-day clinical job? Okay, and that's what I want you to think and reflect as well, because if it doesn't change overall mortality, should you still keep giving should you still do the screening? It's an interesting question. We discussed that as well in PPCR, and then many other topics as we discuss the clinical research topics. Okay. And another example as well is placebo. There's an very interesting story here. I don't have time to go over, but how a drug, when you think placebo, acts, and a placebo when they think a real drug, and so on. So the effects change as well in terms of the expectation. And again, all of this has an effect in trials. And another very interesting story, interesting but sad, the opioid story. And so in the US, physicians start prescribing more opioid for what? For non-malignant chronic pain, which is a very problematic approach. And they start doing based on one paper published in Pain Journal, not Pain Journal, but the journal called Pain, because there is one journal is called Pain Journal. The journal Pain, that are showing what? Chronic use of opioid analgesics in non-malignant pain. And based on a case report, 38 cases, showing that the risk for addiction is low, they use that in a way to start to give the evidence to start prescribing more opioids for those conditions, which is wrong. We know that no, the story is not like that. It does lead to addiction. It does lead, as we saw, what in the graph that I showed before, in 2021, that was from 2021, and that graph is intentionally because in 2021, if you remember what was happening in 2021, there was the COVID pandemic, and was a little bit of unfortunate coincidence, but the day that COVID reached a million deaths, opioid mortality or mortality related to opioid, not in different types of opioids, also reached $1 million. There was a few days of $1 million, a million patients. There is a difference of few days. Okay, so again, so even other public health issues that sometimes we don't give that much attention, it also comes from what? A poor interpretation of clinical research data, because at the end of the day, you can't have these conclusions from a case report, and you learn very well in PPCR why not, okay? Again, and also all other very interesting results showing how the trial changes when the pivotal trials had to declare what was the primary outcome. Then suddenly the significance disappeared, showing the importance as well. And then perhaps in the past we're considering significant things that were not. Okay, Vioxx case as well, very interesting case as well. So again, we don't have time, but that's also show there is a misreport, but also even the data that they reported before, the signal was there. Clinicians may give less attention to the harm and just focus on the benefits. That's also a very interesting issue that happens and that can have an effect in medicine. Okay. And again, at the end of the day, you can say, look, okay, I had my research training in my medical school, in my residency, in my PhD and so on. So, and I challenged that a little bit. And I know even I had students from Harvard Medical School, residents from Harvard teaching hospitals and so on in my lab here in Cambridge, Massachusetts, here, Harvard. And there is no, again, I think that what happens with these clinical research courses, statistics, epidemiology in school, the students are not very interested in the format, etc. So again, I think there's different issues and also usually statistics is taught separately, not in the as applied statistics connected to a project. So it doesn't work. So at the end of the day, clinicians, they ended up having very little training on methodology. And that's a big problem. Again, I have no doubts that you can be a much better clinician. And of course, you can also become a researcher or a clinician scientist as well. Okay. So there's a need. Yes, there is no question about that. And that's an interesting thing because you can say, look, yeah, this can be done anywhere. Absolutely. Again, it's not many great people likely close to you know that. I think that, but the difference on PPCR and we don't have all the answers, but the difference here is with the learning methodology and the community we created. That's why, again, I don't even like to think, yes, this is a Harvard course, but these are global. Everyone is teaching everyone. That's what I try to do it in this program, and it works very well. You are not just learning from the faculty from Harvard, but you're learning from everywhere, and everyone is so engaged. Finishing this open house, I'll have a meeting with the candidates for becoming a mentor in this program. And they're also very enthusiastic. That's an interesting thing. So the training continues for those who want it, of course, even after PPCR. You take PPCR for 1 year. And I have some colleagues with us now for more than 10, 15 years, okay? So it is critical. And again, and I see PPCR the career paths, having different career paths here: clinician scientists, industry, government, and so on. Again, some of you are doing the match, doing the PhD, finishing the PhD. It was very interesting. I talked to some of you as well in this past few weeks to see PPCR was adequate, and was very interesting to hear about your stories. And again, I've seen many great stories. One that I like to mention is Andre. He was also my PhD student, but he learned methodology in PPCR, and it was interesting that again he learned everything. He was in Brazil doing his residency, did not know anything about clinical research, and learned. I started doing his trials, and then in a small lab in São Paulo, Brazil, and then started publishing, even publishing the main trial here in New England, Journal of Medicine, published in German, and so on. Now he's chief of a service in the UT, University of Texas, I think Southwest. Has a big research center there as well. Moved there because he was recruited to come here. And then again, he has become this very important scientist in the area of psychiatry after the training, and many other stories, but that's one that someone, again, you came without any knowledge of anything about clinical research. Okay, there's many stories as well, industry, etc. Just summarizing. Again, some of you as well, they finished a PCR, they decided to go apply for a master's at Harvard. It's interesting now they're getting the acceptance, and my experience that everyone who took PPCR, except if you don't have the requirements, the TOEFL test, etc., I think most get accepted. And if not the first year, they do it again the second year, or they take another program as well, and then they get accepted. Even more competitive programs like a PhD, you get accepted. Even now, I think there's three PPCR alumni doing a PhD program, which is very, very, very competitive. Gabriela, Chris, and Camila. Oh, there's another one. There's actually four, which is actually the PhD programs is very small. So again, PPCR really give a big foundation for those who wanted to do more. Maybe you do PPCR, that's it, which is very fine. But maybe you wanted to do more as well. Again, and how we do that is collaboration. Again, the word is collaboration. You collaborate with this global classroom, 500 or more, a little bit depending on the year, but and also with the mentors and so on. So we develop this learning community in PPCR. That is the goal here. Okay, that's what I call, and that's what I like to say, because learning comes from within. And that's one thing that I also have other program education. It's if you truly wanted to learn, it's not about, there's no magic pill. I like to give that example. So you've seen the movie Matrix. So you take a pill in the movie, you take a pill and you get all the knowledge. Yes, of course, that does not exist. And same thing here as well. So learning comes from you being motivated, you connected with your peers, you going Thursday's lecture, you reading the material, getting interested, you doing the projects. That's why one thing PPCR, connection is very important to us, collaboration and interaction. That's why it's the mentor role is very important, because it helps with the connection. It helps with the human interaction. And that's why PPCR is very based student-centered, not the model that likely some of you pass your whole life, academic life, with the teacher centered. The teacher goes to the front, give the lecture, leave, and then do an exam at the end of the semester. No, that's not the model that you learn. This is, again, the model we think we learn, and then but we don't. That's why many concepts you learn with this method, you have no idea as well, even if you try to remember. But the method that you are interested, get motivated, you test it, you try, you apply in real life, the student center, that's how the method that works. Why? Especially now, this slide, I have it even before AI, but this slide is even more important now with AI. Nowadays, if someone wants to make it, you need what? the understanding and wisdom. So you need to understand that AI will do the mundane tasks, will find the information, it will give the information, but you need to make a sense what that means. And the AI, of course, will not substitute, but for those who average knowledge, I'm sorry to say, but you'll be left behind. I think this is obvious. I don't need to say, but that's why. So, and you can say, oh, but AI will do for me statistics, will do, no, it will, but at the same time, no, because he'll give you a bunch of numbers, but there's no interpretation, there's no meaning. What does it mean that, yes, the same thing as I said, maybe he'll show one group is different than the other, but what does it mean? Could you have done this? Again, AI, for those who do not know, it's even a disaster because it's, uh, someone who knows how to ride a bike, and then you give this big motorcycle and you have no idea how to drive that, it's ended up in disaster. Same thing about AI. Okay, and we'll see more and more this happening. So you need to understand. Okay, and then I just need to be careful with the time. Again, and then I discuss a little bit more in terms of in our first class why collaborative learning is important, the basis of learning, and so on. The community of learning we develop. And I think the last point I want to say, the program is centered in 3 major group papers. You develop papers in the program. So your learning is, you have to do it in order to learn. A systematic review, a real data analysis. Usually we use Enhance, a database that was created by CDC with real data, and then a grant design, okay? And then some of them, they submitted for publication. We have a journal that's international journal, peer-reviewed and so on. So they get submitted to us, some submitted to other journals, but they get it published. And I think also it's a great, and it goes as any other paper. They work super hard, they submit it, discuss with the reviewers, learn how to do it, have rounds and rounds of review. It takes a lot of work. If you think it's easy to do a paper, it's not, but it's a lot of learning, and that's how it changed science. Okay, and so, and that's how the program runs. The program, you have 7 modules: clinical trials, introduction to statistics, epidemiology and real world data. And then you go to real data analysis, apply the statistical analysis, apply the statistics, and conduct clinical research. And here you have the papers being run, okay? We use a public available data set. In the past, we use ELSI, and the ELSI is a great data set, by the way. Now we are focusing on Enhance, but again, even some groups may use other data sets, okay? Every year we create challenges for the group, very important, very interesting challenges: testing, understanding powerful free medicine, exercise, sleep, and so on, treat and understand core board dysfunctions, metabolic dysfunctions, so on, exploring novel treatments and challenging current treatments. So these are some of the challenges: conquering inflammation, obesity, enhancing longevity, exploring novel treatments, and so on. And then again, this is again, the learning has to happen with the projects. That's the important part. Okay, and we have lectures every Thursdays, and then the lectures, it gives the pace for the program. Okay, so then you read the material, you go to the office hours, you collaborate with your colleagues, and then you come to Thursdays, and then you learn from the lecture, but then you go back as well, and then you discuss and so on. So and it runs fast. And one thing, and I think my last thing before, I know we have 13 minutes, we have textbooks that we wrote for this program. That's very, it's very important as well. And then I think last thing, and I think I can open for questions. In terms of one of the questions, participants got a little bit of anxious. Oh, is that too much? Because we're ambitious. We wanted you to, the investment you make it in the program, we want to be worth every penny. So you learned a lot of things. it's interesting. Sometimes the participants complain, but it's the opposite. More you are doing, more you're learning. And the learning is the most important value you can have it. I know it's obvious, but sometimes it's not as obvious as it is. And nowadays with AI, it's even more important, believe me. Otherwise, clinical research will go down or go up. The machine will not do it for you. I know it's obvious, but I think it's important to repeat. Okay. And then can you do it? Everyone can do it, as busy as you are. Oh, but I have my family. No, I can't even count the number of people having babies are getting born and so on, and small kids and older kids and this and that, or finishing residency, PhD, and so on. If you wanted to do it, this will help in the other areas that you're doing, unless you're from another field, which you shouldn't be, unless there is a specific thing you see. But then if you're interested in clinical research, that's going to help anything you are doing related. And again, and that's the, and you can talk to me in November when we meet in the 5-day workshop. So again, participants, they change. And then I've seen transformations all over. So again, it is a wonderful journey. I hope you join. I'm very passionate about the program. Again, for me, this is a mission in terms of I want to impact clinical, not only clinical research, but how medicine is being conducted. So more people have it, and I want to do this at a global level. That's why this methodology is so important. And I've seen changes. I've seen, again, in institutions and countries like Dominican Republic and New and so on. So I hope you join. And then any questions? So again, we have 10 minutes. I think I did not look at the chat, but I'm sure Ellie, Alma, and AJ were responding the chat. And then we can open for questions, or we can also then go to the sites. The site director can give a hello as well. So let me ask anyone wants to, and apologies to go a little bit faster, but we wanted to keep these under 1 hour. But any participant wants to use the microphone. Enrique, I'm sure there are questions on the chat, and then you guys are all set, correct?
Yes, we were answering the questions in the chat.
Okay, perfect. And then anyone wants to take the microphone and ask your question, and then we can also get our site directors to say a quick hello if you wanted as well. Go into we create breakout rooms for the sites. If you think it's an interesting thing, we can also assign you there as well. But again, any questions you wanted to do, please do so. In the meantime, as you attend, you can interrupt as well, but let me call some site directors here to say a quick hello in these last 9 minutes. Tamara, hi.
Hi, Felipe. Hello, everyone. It's so great to be here with you. So I've seen some questions about the application for residency, and it really does help. I've seen several of my alumni from San Martin University get into very, very competitive residencies. So it's also a very good path into a residency application in the US. Not only in the US, there are people that went elsewhere too. And specifically in San Martin, if you take the diploma with us, we will give you a diploma from San Martin University with Peruvian credits, which are valid for a master's degree in Peru also. And we have been working in some research integration with our research site in San Martin. So we are able to give PPCR students access to our research institute in our school, and help with the grant applications, and have affiliation with a university, which is certainly very helpful for grants and for publications. So there's a lot of things that we're doing, and I'm very glad to be here. Thank you, Felipe.
Thank you very much, Tamara. And yes, a very, very good, good point. And it's interesting because some of the students that Tamara knows as well, they came here to the lab as well. They now are faculty and some as well. One of Alejandra, she did her residency in Johns Hopkins, a very prestigious institution, and now going for her clinical position and faculty. So we're seeing great successes, stories, and great. Tamara, that was a very good point as well. Let me see here. I'm going on the camera. We have Abdul from Saudi Arabia. We are trying to get at Tabuk University. Abdul, you want to say a quick hello? We don't have too much time, but a quick hello.
Yeah, sure. So, hi everyone, I'm Abdul from Saudi Arabia. So, we do have a site since 2016 with the PPCR, and the same as Tamara said, we have seen a lot of change in our candidates. They are collaborating with us. So, it's a great opportunity for all of you. And as we were discussing, we are very flexible, like if you do have any issue with the time on Thursday, we can put it on Friday for you as well, like, and we can have like flexibility in timing. I know because in Saudi Arabia and Thursday sometimes it's too late, so we do have Friday, and we do have solutions, but it's a great opportunity to collaborate. And recently, like, we do have a lot of grants opportunities in Saudi Arabia. Like, we do have a great opportunity, so you guys can have a great chance, to avail this collaborative opportunity in PPCR, and then like grow yourself. It's a great chance, So I welcome you all. If you have any question, things, we can have even more meetings with you guys to like elaborate more on the program. So thanks,
Very
Felipe.
good. Thank you very much, Abdul. Wonderful. And then again, I discussed with his team at Tabuk University, and he wants to really spread that to our colleagues in Saudi Arabia. And then, Laura, you want to say hello regarding the site in Paraguay?
Hi everyone, I'm Laura from the Paraguay side. Thank you for joining today. This course is amazing, an amazing opportunity. You learn a lot and grow through the experience. If you have any question, feel free to ask. We are more than happy to help you.
Perfect. Thank you very much. And then we have Maria Zunilda. She's here. I don't know if she can connect or not with the camera. Hi, Zunilda.
Hello, Felipe. I'm here, but I'm not with in the camera now.
That's
Hello,
fine.
everyone. Just amazing what PPCR did at Dominican Republic. We already have around 200 MDs certificated from the program. And with this, we are preparing how to move on to master and later to PhD. So I think it will be great if I can see that. It's amazing, and I saw the evolution from 2012 when I did PPCR to now. It's different. It's better year by year. So I'm so happy to be with you at this time.
Very good. Thanks so much, Zunilda. As I said, she's the one who truly planted the seed of PPCR clinical research training there in Dominican Republic with this very strong group as well with alumni. So and Ellie is one of the alumni who joined my lab and is doing so wonderful here in the lab as well, and other things here in Boston. Very good. Thank you very much. And then I think Thaisa is here. She has been leading the site in USP Ribeirão. I don't know if you can say a few words, Thaisa. We are 3 minutes to finish, but at least a quick hello. Let me see what.
Hello, Felipe.
Hi.
Hello, everyone. It's a pleasure to be part of PPCR again since 2013. So I make myself available to clarify any questions and help with whatever you need to facilitate this amazing opportunity. Thank you.
Thank you very much.
Nice to see you.
Great to see you. Oh, we have here Salvatore. Sorry, I was looking for you. I found you now. Salvatore, our great colleague from Italy, running the Italian site. Hello, Salvatore.
Hi, Prof. great to be here with you guys, and thank you, Prof, for taking me to say 2 words. I think that we are going to do a great work also in Italy, and we are very engaged in expanding also the message of PPCR in my country. We hope to do our best next year too, Prof. See you guys from Italy.
Very good. Thank you very much, Salvatore. Let me ask Eli, Alma, and Eneji, any other site director I can't see here in the list?
We got Blanca, professor from Mexico.
Oh, Blanca. Hello, Blanca. We have again very nice sites in Mexico as well since since the very beginning. I don't know if Blanca can connect.
Hi, everyone.
Hi, Blanca.
I'm sorry, I don't catch. What was the question?
Oh, no, Blanca, sorry. I just wanted for you to say hello as well. And then you run the site in Tech in Monterrey. But just a quick hello to the participants.
Oh, yes. Hello, everyone. And we're open to all the people who wants to be in this incredible course in which you can find a lot of friends, a lot of knowledge, a lot of experience, in which you have the opportunity to write your first article and go on.
Sure. Thank you very much, Blanca. Great to see you. And I see Mario as well from our site in Recife, a great site as well, as I mentioned. Hello, Mario. A quick hello.
Hello. Sorry.
We can see you. Yes.
Can you hear me?
Yes.
Can you hear me?
Yes, very well.
Okay. No. So it's a great pleasure for me to be part of PPCR since 2025. So since 3 years we are being part of them. So we are expanding our program here in Recife. So it's a very nice program, and you will learn a lot. So I can say it's like a family, a community, and every year you stay on the program, you grow and you learn. So it's very recommended, highly recommended.
Thank you very much, Mario. Another, again, great site as well in Northeast. And then I'll have Artur as well. Artur is now leading the site of Fedor in São Paulo. Artur is doing great. Hello, Artur. A quick hello, as we are 5 p.m. But we can have a quick hello from the site in Idor, Artur.
Hello, Professor Felipe. Hello, everyone. I'm really happy to be here today. It's my first year as a site director. I finished PPCR course last year. It was an amazing experience. I think everyone is challenging yourselves for this amazing course. You will be happy in the end, especially in the 5 days. It's you see all your involvement. So welcome all of you. I'm here for whatever you want.
Very, very good. Thank you so much, Artur. Again, Idor has been wonderful. We have different Idor sites. Idor in São Paulo is our main Idor, but all the Idors are great sites as well if you take it from there. Again, I see a number of alumni and also mentors are connected. So everyone, is just 1:05. Is there any other site director that I couldn't see here? I know Pedro and João, they are representing Thais, I'm sorry.
Correct. Yes.
And then for the,
Yeah.
Go ahead, but just very quickly, just a quick hello for the site in Manjique.
Yes, my name is Pedro. Me and João, we are currently doing the favors for today's because she's currently in Boston right now. But we just wanted to say hi, and then yes, but we're very excited to have you all here. And PPCR is just an amazing community, like he was said before. So it's very interesting to grow as a community and to open your opportunities to research and to make friends and long-lasting working, like a great work environment for all of us. So looking forward for this year.
Colleagues for continuing education, learning always.
Yes.
Very, very good. Thank you very much. Did I miss anyone?
We got Daniel San Juan, professor from Mexico.
Oh, Danielle is here. I didn't
Yeah.
see it. Hi, Danielle. Can you give a quick hello?
Yeah. Hi, everyone. We are so happy to participate with this course more than decades now. I think more than 50 years. So it's a wonderful opportunity to have this solid knowledge to create your own knowledge in your field with the best team in the world. Thank you.
Very good, Danielle. So great to see as well. As we said, it's true. It's one of the first sites as well, the site in Mexico in the Neurosurgery Neurology Institute. Very great to see you, Danielle. And then everyone, I think it's just time for us to finish here. So I think all your questions, if someone wants to take the microphone, I see again a quick hello as well to our alumni, our mentors, future mentors as well. But then anything else, Enrique, Alma, Ellie, and AJ?
If there are any doubts pending, just email us. Remember, 2026 coordinator at PPCR. Applications probably might be extended. I don't know if Professor would like to say something about that because they were asking about the timeline.
Oh, I see. Good point, Alma. So yes, please, if you are interested in PPCR, please do submit it. Do as much effort as possible to submit it by January 31st. That is our sort of very final deadline. There's a good possibility to be able to extend that, but it's important for us to get this by January 31st. We always request this extension. Usually the school grants a few more weeks, but remember we have to start the course in March. So if they give you 4 more weeks, as long as you have your application, that's best. But talk to us as much as you can talk to us. That is better. And you apply, and then you can still work. You have a little bit extra time to work on the financial issues. And if you cannot make it, that's fine. You can do it again, apply again in the future. But again, try to apply by January 31st. And questions, as Alma mentioned, please send it to. You guys wanted to just put in the chat the 2026coordinator.org. So that's our main email. So we all see that email and we answer that email. You're welcome to send me email as well. But I think that email is safer as well, so to get a quick response from the team. Okay, and we can connect you with the site directors that are here if you have specific questions for the site. But we wanted to help you as much as possible to get you in for this program. All right. And with that said, everyone, again, look forward to work with you all. Thank you so much for coming. We have that in YouTube as well, but we have the recorded lecture we can send by email for everyone who registered. And again, look forward to seeing you. Thank you everyone for coming. Bye everyone.